In 15th January 2020, WHO has announced of a new disease called COVID-19. COVID-19 has 29903 nucleic acid bases, and each country used the different primer and probe, so we cannot confirm by RT-PCR that case is 100% positive or negative. If the virus evolved, the vaccine that is made by spike protein isn't capable to protect the evolving virus because of mutation. This chart proved in April 2020 by Journal of Immunology. When it infected by COVID-19, the virus will replicate in the mucous membrane. Here the virus and white blood cell, monocyte, macrophage will fight each other and make the people who infected by virus induce fever, cause to death. We call pyroptosis. After virus replication and maturation in epithelial cell, the virus will release and go into cells. This stage we call incubation period. When you lose energy, you may go to die because you have no energy. If you die due to lost energy, we call apoptosis. If has dysfunctional immune response causing excessive infiltration of monocytes, macrophage, and T cells. Systemic cytokine storm, pulmonary edema and pneumonia. Widespread inflammation and multi-organ damage we call necroptosis. Non-neutralizing antibody may cause ADE of infection. This chart proved in December 2020 by Germany talk about nuclear factor kappa B pathway and treatment COVID-19 patients. When it infected by COVID-19, the virus will destroy ACE2 and produce nuclear factor kappa B. When ACE2 is destroyed, the angiotensin 2 cannot be angiotensin 1 and 7, inducing hypertension. If nuclear factor kappa B appear, nuclear factor kappa B will produce P65 and induce interleukin 1, interleukin 6 can cause cytokine storm. Steroids, NSAIDs, used to treat nuclear factor kappa B or immune storm, but it has a lot of side effects and immune suppression. This chart proved in 2022, COVID-19 infection induced the expression and secretion of GP73. Circulating GP73 travels to the liver, where it activates pKa, increases the expression of gluconeogenic genes, and augments hepatic glucose release. GP73 also impairs insulin-mediated glucose utilization, which, when combined with the above, elevates blood glucose. This chart tells us if has ATP, then have NAD+, then have sirtuins. The sirtuins will be stop nuclear factor kappa B, and immune storm won't happen. If has COVID-19 infection, you will have nuclear factor kappa B, and then you will have CD38, and NAD+ will decrease. It will make our cells have less lifespan and risk to have cancer. COVID-19 infection have ORF3A, ORF8B, NSP3, and E protein that may cause problems to your cell like E protein will damage endoplasmic reticulum and Golgi body to cause calcium ion channel increase, will make calcium ion go into NLRP3 more, may cause multi-organ inflammation and heart failure. ORF3A will make potassium ion go into NLRP3 more, may cause multi-organ inflammation. ORF8B can cause cell inflammation. NSP3 can interrupt NAD+ from producing PARPS. This may interfere the interferon pathway. Discharge in a 2nd February 2022 COVID-19 study report about SP93 pathway research by Dr. Pan in 1978 to 1986. SP93 has insulin-like substance. When we spray SP93 on acupuncture points, the glucose utilization will increase and GP73 will decrease, and defective COVID virus and virus will come out with urine excretion. Glucose utilization increase can help glucose to go into cells, and through the process of TCA cycle creates ATP, NAD+, and sirtuin. Sirtuin will stop nuclear factor kappa B and immune storm. In the first period of COVID-19 in late 2019, Dr. Pan saw that none of the members from Association for Breast Cancer Disease have COVID-19, so he does a research at Lao Asian Hospital and found that 500 of all 15,000 people have COVID-19. Then we succeed of curing all those 500 people and 500 more people in village in Vientiane capital. Then leads to a research in Savanakhet province as the following. This chart is 2nd February 2022 COVID-19 study report. Classification of patients infected with 5 kinds of COVID-19 variants according to RT-PCR next generation sequencing and the virus resonance detected on different acupuncture points by BDORT and quantum light. 50 patients at the camp in Savanakhet province had detected by RT-PCR positive. To separate the type alpha, beta, gamma, delta, omicron, need to use next generation sequencing. Therefore, we use BDORT and quantum light to organize into alpha, beta, gamma, delta, and omicron by BDORT and confirmed by quantum light. For the alpha will be found at Tanjong CV17. Alpha we have 3 people, stage 1 2 people, stage 7 1 person. For the beta will be found at Yamen GB13. Beta we have 6 people, stage 1 1 person, stage 2 3 people, stage 7 2 people. Gamma will be found at Yangbai GB14. Gamma we have 11 people, stage 1 2 people, stage 2 6 people, stage 7 5 people. Delta will be found at Shenque CV8. Delta we have 6 people, stage 1 4 people, stage 7 2 people. Omicron will be found at Shenzhou BL23, stage 7 24 people. By confirmed with quantum light, we will know that alpha, beta, gamma, delta will be at lungs and omicron will be at kidneys. We found that if it's at stage 7, the virus will be at all organs. By detecting with BDOT and quantum light, we separate it into 7 groups. Group 1 have 7 stages as the following. Stage 1, we found virus, antigen. GP73 and omega-3, omega-6. Stage 2 we found asbestos and CD29 will increase. Stage 3 we found EMF will increase. Stage 4 we found CD24 will increase. Stage 5 we found CD44 will increase. Stage 6 we found CD133 will increase, but virus will be in the lung. Stage 7 we found CD133 will increase, but virus will be in all organs. For the group 2, GP73 and omega-3, omega-6 will be found. Group 3, antibody, CD28 and sirtuin will be found. Group 4, we can't find anything. Anything won't be found. Group 5, antibody will be found in somebody, but CD29 will always be found in this group because they are vaccinated. Group 6, asbestos will be found. Group 7, EMF will be found. After treating 50 people with SP93, we found 5 people that test with antigen rapid test kit is positive. So we do a research why they are still positive. 3 of them still have asbestos and other 2 still have EMF, but the virus is gone. And we found that after the treatment, 16 people that use RT-PCR are still positive, but virus is gone. Only GP73 and omega-3, omega-6 are detected. In conclusion, this research of using SP93 to stimulate sirtuin. Listen to the music of 5 elements and 6 movements to activate CD28. Drink yogurt plus Codeta every day to stimulate interferon and enhance immunity. Is 100% successful for treatment, and we found false positive because some patients still have GP73, omega-3, omega-6, asbestos, and EMF, so they need to continue the treatment to another 2 to 3 days to eliminate the GP73, omega-3, omega-6, asbestos, and EMF. So then RT-PCR result will be negative. 22 acupoints that relate to COVID-19. 1. CV17. 2. GV13. 3 and 4. GB14. 5. CV8. 6. CV0. 7 and 8. GB12.5. Left and right side. 9. TE1 left side. 10. SP12 left side. 11. HT1 left side. 12. ST9 left side. 13. ST9 right side. 14. HT1 right side. 15. SP12 right side. 16. TE1 right side. 17 and 18. BL23 both left and right side. 19. GV1. 20. CV0. 21. CV4. 22. CV6. 7 groups has followed. 1. Pyroptosis, fever, have to treat GB14, GV14. 2. Golgi protein 73, GP73, blood glucose, have to treat GB14, SP1, SP9. 3. vitamin D, ACE2, blood pressure, GB14, ST9, UB63, GV13. 4. COVID-19 envelope, E protein, ion channel, GB14, HT1, Ki25. 5. Cytokine storm, GB14 and 22 acupoints that relate to COVID-19. 6. NAD plus depletion, GB14 and 20 acupoints that relate to cancer stem cell. 7. Others are EMF, PARP, long COVID, GV20, GB14, CV22, CV8, GV1, and KI1. 8 acupoints. 1. CV17, 2. BL17, 3. L9, 4. BL11, 5. GB39, 6. GB34, 7. CV12, 8. LV14. This is a research of COVID-19 by Dr. Pan in Laopedia นวัตกรรมโควิด -19 ลาวเฮ็ดลาวไซลาวเจริญ Renovation and research by ourselves COVID-19 ลาว produce ลาว use ลาว develop SP9